if you look at those on the easels over there, you see two bills.
Yes.
And one of them, I was going to remain anonymous, but first of all, I want to thank you so much for your courage, just to speak about what you've been through. That bill that you see on the left, it says, I think it's 22,000 something. That was for one bill in George Washington for knee surgery. And when they found out I didn't have insurance, and I had a knee infection, they kicked me out of the hospital. And that was when I became a universal healthcare activist. I'm like, I don't think this is going to happen to me or anyone else again. When Michael Moore did Sicko, and Donna Smith, who was a star in Sicko, he got 25,000 stories within 4 weeks. Does everybody remember that in the movie? Did any of you see Sick Around America last night? Raise your hand if you saw it. That was Sicko Part 2. Now you're Sicko Part 3. I'm Sicko Part 4, and there's all kinds of people in the audience who've gone through this. The question, I think, that we have to begin to ask ourselves, we're talking about this at 4 o'clock, and maybe some of the panelists can address this too, is does this cycle of misery and bankruptcy and medical debt and not getting the care that you need, will that continue with new healthcare reform? If it does, that's not universal healthcare, because those are financial barriers that still remain in the system. Europe and Asia don't have those financial barriers. That's why it's a universal system. So we want to be a gold standard, like 676, not fool's gold. But thank you for your story.
No, absolutely. Yes, ma'am.
Representative Massa, first of all, congratulations on your seniority. Glad you're enjoying it.
This time 2 years ago, I had 0 days of seniority.
Okay, well, you're making progress. Keep going.
With the special election, you're not the bottom anymore.
Someone's going to be junior to me.
My question is, what are your current thoughts on sort of shedding the sunshine on really what are the health insurance companies talking about in terms of the small fine print details that have been discussed? Because we're, as advocates, we're having a really difficult time finding out what they're really planning on proposing.
I join you in having a really hard time.
Okay, well, and I don't have any seniority, right?
But the good news is I have actually had a sense of some measure of openness and inclusion from the administration. We had to kind of kick a few doors down and make a little noise, but just about everybody has a seat at the table. I personally asked the president about the public option. I said, what gives? Actually, what I said was, Mr. President, many of us are concerned. It appears that we're moving towards institutionalizing private for-profit health insurance. What about the public option? His quote was that he thinks the public option should stay because it keeps the private health insurance companies honest. Now, that's an interesting viewpoint, and it gives me hope that we're going to have a place at the table to move forward. I think it's going to be very, very hard to achieve overnight a goal of a universal single-payer system. I think it's going to be difficult. At this point, I'd be delighted if it's an option and people can opt into it. Because I guarantee you that 50 million people who don't have health insurance today will opt into it. And I think that that's where we need to head. In fact, if you study the progressions of other industrialized nations, that's often how they got there. So I'm very optimistic, but I can't give you much detailed insight as to what's going to roll out for the great debate. And it's going to last about 6 months. The commitment is fully on the table that this country will achieve health care coverage for all Americans this year. The bill will come to the floor. We will vote on it. I guarantee it. That I know. I do have concerns about making sure that all options remain intact, and that's where the fight is. Yes?
Just sort of following up on that, public option as keeping them honest rather than as a competitive alternative. Do you foresee a competition restriction on the public option in the final bill?
If private health insurance companies have their way, yes, I do. And this is part of the problem. That's why experts in powered panels like these are so powerful. Because whereas I can speak with a great deal of firsthand, by the way, this is the day, 10-year and 6-month anniversary of me having been diagnosed with terminal cancer and needed 4 months to live, 10 years and 6 months ago. So trust me, we're around for a lot longer. I have a very passionate personal stake in this debate, as 55 million Americans do. but we need the experts who empower in these panels, who bring all the nuanced history together, so there can't be any gotcha moments. And to those who say, how are we going to achieve this? In this room right now, there's probably 4 million email addresses. In this, well, probably more, AFL-CIO, there's probably 5 or 6 million email addresses. And we need to get smart to get people energized and start that communicative process, because Congress really does listen to grassroots. We're not a bunch of socialists. We're not a bunch of communists, as we're painted so many times. We represent working Americans of all statures. And by the way, a lot of people who used to make $500,000 a year are now out of work and don't have health insurance, and are now dealing with the problems that they thought they would never have to face. So I'm very optimistic. Every morning I wake up more so.
This is a follow-up. Do you see you or any of the rest of the 676 supporters able to vote for a bill that puts a competition restriction on the public option?
No, I don't. I don't see that, and I don't think that's why I don't think it will survive. Because there's so many 676 supporters who have been in this fight for so long, I don't think that we're ready to surrender that. And so when you're talking 100 members of Congress, you're talking a big block of votes, and you suspect, take off the majority on the other side, that's 50% of everybody's going to vote for it. So I don't think that that's going to happen. It's going to be real leverage. But again, I return back to the importance of the experts who are empowered in these panels here, and we're going to be doing these all over the country. In fact, I'm going to St. Louis 2 weeks from now, I believe, on the 16th, to have a large conversation with the whole community, and now even Pittsburgh. Then I'm going to go to San Francisco. I'll go wherever they're sending me to give this visibility.
Let me say something about the public option. As I said earlier, the kind of plan that's being talked about with an exchange or a connector like Massachusetts have will not lead to universal health care, because the experience says that if you mandate something, not everybody signs up. The kind of public option we need is one like we have in Medicare. When you turn 65, you're not asked, do you want to be on Medicare? You are automatically on Medicare. The kind of public option that we should be talking about, and that if we're going to support one, is the only kind I would think we should support, is one where you're automatically on it. Anybody who doesn't have insurance should automatically be on a public plan. Anybody who's unemployed should automatically be on a public plan. I haven't heard any proposals for what to do about the unemployed. If you're automatically on it, that means that that's your default choice. You could perhaps, and I wouldn't favor it, but you could perhaps choose to go to a private plan, but you would automatically be in a public plan. That's the only public option that makes any sense to me, because it's the only one that will lead to universal care. You would then be basically born into it. Every child that's born would automatically be on the public plan. Their parents could make some other choice, but they would automatically be covered from the day they're born.
Like 676, where you're actually born into a single-payer universal system.
Right, exactly.